guys, welcome to my channel Learn with Geetasri. If you are viewing my channel for the first time, subscribe to my channel. And in the previous video, we have seen the most important questions which will be asked in interview round of written test and technical round. Let's see some more important questions along with part 1 which are mostly asked in the interview. If you haven't watched the part 1, please go and watch. There are so many important questions which we are discussed in part 1. So let's get into the content. You have to be sure about some ICD guidelines. They are MI guidelines, that is myocardial infarction guidelines, cancer guidelines, HIV guidelines, CKD guidelines, hypertension and its combination codes, diabetes guide. Regarding this hypertension CKD combination code, you will have so many codes and so many confusion. So practice this to avoid the confusion. Going into the questions, difference between ectomy and ostomy. Ectomy is the surgical removal of a specified body part. Ostomy is making a surgical incision or surgical opening. What is aneurysm? Aneurysm is the ballooning and weakening of the arteries. And this is also an important question about pregnancy trimesters. There will be 3 trimesters. In first trimester it is 0 to 12 weeks. Second trimester it is 13 to 27 weeks. Third trimester it is 28 to 40 weeks. And it is also an important question. They may ask, explain about excludes 1 and excludes 2. Excludes 1 means not coded here. The 2 codes should not be reported together. Excludes 2, not included here. The two codes can be reported together. What are neoplasms? What is metastasis? This is the most frequently asked question. So please go through this topic. The term neoplasms refers to an abnormal growth of tissue, and metastasis, spreading of cancer from one body part to another body part, is called as metastasis. And here also remember another point regarding this primary cancer and secondary cancer. If the provider is stating metastasis from, it is called as primary cancer. If the provider is stating metastasis to, it is called as secondary cancer. Expand HIPAA, Healthcare Insurance Portability and Accountability Act of 1996. This they may ask in the written test, and this is also a repeated question in CBC examination. What are modifiers in CPT? You may see these modifiers in anesthesia section. Modifier provides additional information about the medical procedure, service or supply involved without changing the meaning of the code. Generally, we will append modifiers when the same provider is involved in multiple procedures on the same day or the different days. Internal respiration and external respiration. Generally, external respiration occurs between the lungs and the body. Internal respiration occurs in the body tissue, that is after the external. It occurs within the body tissues where cells release carbon dioxide and take in oxygen from the blood. Smallest and longest bones of the human body. This is a basic anatomy question. Longest bone is the femur, smallest bone is the stapes. Also remember number of bones in the human body, that is 206 bones. What is the most useless bone? It is the human tailbone, that is coccyx. How many organ systems in the human body? There are 11 organ systems in the human body. You must have a glance on or basics of the 11 organ systems. Like you should be able to answer if they ask about the basic parts of the 11 organ systems. And one body system thoroughly if they ask to explain about a body system, just like how we discussed in the part 1. Difference between adverse effect and poisoning. Adverse effect is a reaction to a therapeutic substance currently prescribed and administered. Poisoning is different, and it is the improper use of medication. Toxic effects are also coded using this TDC. What are outer layers of heart? Heart will be having 3 outer layers. They are epicardium, myocardium and endocardium. Function of retina. Retina captures the light that enters your eye and it helps translate into the images. What is the normal heartbeat rate? Generally 60 to 100 beats per minute is the normal heartbeat rate for an adult. Next one, NOS and NEC. This is the most important one. This is NOS is not otherwise specified. NEC is not elsewhere classified. Function of spleen. Spleen is the storage of red blood cells. It removes the white blood cells, cleanses the blood, and it metabolizes the hemoglobin in the blood. What is synapse? Synapse is the connection between two neurons. What are the parts of large intestine? Large intestine will be having the parts like colon, cecum, ileum, rectum, and anal canal. Gestational diabetes. Gestational diabetes is a type of diabetes which develops during the pregnancy. And in third round, that is HR round, they may ask some questions which is not related to concept. They may ask some logical questions like why did you choose this medical coding sector, what do you know about this company, how do you handle work pressure, why should we hire you, where do you want to see yourself in next 3 years. Like this they will ask some logical questions. You must answer this carefully. If you want to know how to answer this HR round, please comment and I will make a video on that. Also, if you want more conceptual questions which are mostly asked in written round and face to face round, please comment. Also, view my previous videos for more information. Like this video and share to your friends so that this video will be helpful for them also. Subscribe to my channel for more important informative content. Learn with Geetashree. Bye bye.